These are Kenya's new government doctors, Cuban medical specialists who will be deployed to some of the country's most understaffed and ill-equipped public hospitals. Local doctors are angry. One took action saying the process was flawed and arguing there are almost 200 specialists in Kenya who are unemployed, and even those in work are not being paid as much as the Cubans.
Each of these cadres we are speaking of, they are there in this country. The question they argue is that it's about numbers. That is fine. We even agree that 100 doctors cannot help the whole process. That is true. But what we are saying is the process of hiring these doctors at higher scale of salary, it is abusive to the rights of doctors. Yeah.
The decision to hire foreign doctors stems from the government's frustration over frequent doctor strikes, including one last year that lasted for 100 days and caused major disruption to services in public hospitals. George Mutiso struggles to get the specialized care he needs. He often has to travel from his rural home to this hospital on the outskirts of the capital. He told us it has taken him 4 days to see a specialist. The situation is worse in Mutiso's hometown. Some rural hospitals have not had a specialist in years. The doctor-patient ratio in the country is 1 to 7,500. That's 7 times more than the WHO recommendation of 1 to 1,000.
We signed a memorandum of understanding that we get some Cuban doctors to come to Kenya and help us re-engineer our health delivery system in a way that we can prepare effectively for universal health coverage.
The court has dismissed the case by the doctor to block the hiring of the specialist from Cuba. The doctor says that he's going to appeal. Some Kenyans are happy with the new arrivals. They say that patients who can only afford public health care need all the help they can get. But they also know that these doctors need adequate medical supplies and proper equipment to be able to do their jobs well. Catherine Soy, Al Jazeera, Nairobi.